There are certain foods to avoid with gastritis, some of which include carbonated drinks and foods high in fat. Basically, any foods that irritate the lining of the stomach should be avoided, with citrus fruits being some of the biggest culprits. Other foods to avoid include beans, broccoli, and cauliflower, as these are known to produce gas in the gastrointestinal, GI, tract, which can worsen symptoms. Alcoholic beverages should also be avoided when experiencing symptoms of gastritis. Gastritis is a medical term for inflammation of the lining of the stomach, and this can be caused by any of several factors. Bacterial and viral infections are common causes of gastritis, but consuming too much of certain foods may also cause stomach distress and other symptoms. Most patients who have been diagnosed with acute gastritis will be advised to consume a bland diet for several days, or until symptoms diminish. A medical professional may provide a list of foods for gastritis patients to avoid, or he may give simple instructions for his patient to follow. In most cases, the healthcare provider will instruct the patient to refrain from drinking alcohol until symptoms disappear. Patients with gastritis may also be advised not to take products containing aspirin or ibuprofen, as these may cause abdominal bleeding in some individuals. Foods to avoid with gastritis may also include fried and fatty foods, such as French fries or fried chicken. Baked and broiled foods will often be better tolerated by most patients with this condition. Foods prepared with vinegar or mustard should also be avoided. Most peppers should not be consumed, and spicy or hot condiments are other foods to avoid to help relieve symptoms. Any foods that increase acid production in the stomach and intestines should be avoided. This will generally include oranges and citrus fruits, tomatoes, and cabbage. Other foods to avoid are apples. Onions and garlic may increase gastritis symptoms in some patients as well. Milk and other dairy products should be avoided or consumed in moderation. Some types of fruit juice may worsen symptoms of gastritis. A few drinks to avoid include orange, grapefruit, and apple juice. Lemon juice may worsen symptoms as well. As a rule, ground beef or pork should be avoided when experiencing symptoms of gastritis. This is due to their high fat content. Sometimes, even lean cuts of beef could aggravate symptoms. Lamb should also be avoided. Most seafood can be tolerated by many individuals, with the exception of herring and salmon, which are high in fat. Other foods to avoid with gastritis include rich and heavy creams and gravies. This includes cream-based soups. Most salad dressings should also be avoided. Rich desserts such as cheesecake, puddings, and ice cream should also not be eaten when experiencing gastritis symptoms.